So, Dr. Vangipuram Rangan, what do you see the future of ADCs being? Do you see them used possibly, or what other kind of cancers can they be used in? Do you see a future beyond cancers? Like, what's your outlook for the technology?
I think the antibody-drug conjugate has a huge potential because of the success of the Seattle Genetics drug Adcestris, which is an antibody against CD30 and conjugated with a tubulin inhibitor, and that is being used for Hodgkin lymphoma. And recently Genentech had come with a Catcycla, which is the TDM1, which is called, and it is being used for breast cancer, to treat breast cancer and this thing. So the overall response rate of the Seattle Genetics antibody-drug conjugate is more than 60%, which is not heard of in in cancer treatment, and even in terms of TDM1 for breast cancer patients, it is close to about 30 to 40% overall response rate is shown, and so there is a huge potential for antibody-drug conjugate to treat cancer, and so I think in the next 5 to 10 years, the antibody therapeutic field will be more focusing towards generating the antibody-drug conjugate, and so that's the reason why many of these big pharma companies like Genentech, Bristol Myers Squibb, Pfizer, Eli Lilly, and then they are all moving towards having some technology to generate antibody-drug conjugate to treat cancer. And right now the focus is more toward cancer, and potentially whenever you need to kill a cell expressing a specific antigen using some cytotoxic component for variety of other indications like inflammation or anything like that, you could use the same approach and everything. And so there is a vast potential for antibody-drug conjugate in the next 5 to 10 years. The field is improving in terms of how to make these antibody-drug conjugate, and what is the drug to antibody ratio, and how we select these target antigens, and what is the receptor cell density that is needed. And once we have better handle on all of these things, so this field is going to grow enormously.
Wow, that's fascinating. Thank you very much for your time, Dr. Vangipuram Rangan.
Thank you.